health basics. We're talking today with Dr. Richard Natale. He's a urologist and men's health specialist with Carolina Urology Partners in the Charlotte, North Carolina region. Dr. Natale, I want you to first and foremost remind listeners who you are and where your passion for men's health comes from.
You got it. Hello, everybody. My name is Richard Natale, urologist out in Charlotte. Was born and raised in the California area, moved to the East Coast to do my medical training, with most recent training being down at Florida for my residency program. Why urology and more specifically why men's health? I think it's the idea that I can really partner with my patients in addressing issues that, I'm sensitive about, right? Things that I think that most guys will have a struggle with at some point in their life, whether it's testosterone issues or urinary issues or erection issues. It's about focusing in on those unique issues that we deal with and being able to get guys past them and back to where they want to be. So it's a neat field. It's one that has interested me and I feel very passionate about it and try to stand up for my guys and be their advocate, be their cheerleader for them. So that's what brought me into that field.
And today I want to talk about when to see a urologist, when to see a urologist, maybe even some will get into what a urologist is versus a primary care doctor, all that stuff. But before I dive into that line of questioning, I want you to tell our listeners one time that you helped somebody and it kind of just reinforced everything to you that this was indeed what you were meant to be doing in life and this was something that you love doing. I just want to hear about one of those moments.
One of the most impressive moments in my life, it really truly, was a patient of mine several years back that had had a prostate removal maybe 10, 15 years prior from a urologist in a smaller community outside of ours. And for that period of time after surgery, he remained completely incontinent. I mean, he was in diapers, peeing on himself on a very regular basis. So he came to me understanding that I do something called artificial urinary sphincters, surgical procedures to help correct that incontinence issue. So, we get him through the surgery, he recovers, and when we use these devices, they don't work at first. We kind of lock them open, and then when the patient's healed, we activate them, so to speak, so they can start using it. And I'll never forget this experience because it really, truly brought tears to my eyes. The kind of habits I do is I'll go into the room with the patient and I'll examine them. I'll turn the device on. I'll ask him, I said, I'll come back in a few more minutes to let the device completely cycle closed. When I came back, I'll have them stand and I'll put a tissue in front of them and I'll say, okay, strain like you're going to have to go pee. And he didn't leak at all. And literally, I'm getting tears now almost, is that he, after he got dressed, he started crying. I mean, he had tears streaming down his face. He hugged me and he said, thank you so much because this is the first time I've been dry in 15 years. That was probably the most rewarding thing that I have had, that experience in all of my career. And certainly in the career of really focusing in on men's health, it really touched me and absolutely gave me the energy and the drive to keep doing those things for my patients.
I want to know about a urologist, what a urologist is, and how it's different than a primary care doctor. So you mentioned the urinary issue just then. Urologist, urinary kind of sounds like they maybe go hand in hand. So why don't you just explain to our listeners what a urologist is?
Well, we are surgeons. That's the first thing. So I do have some patients that ask if we do surgery, and the answer is we do. We start from the kidneys down. So we take out kidneys, for example, for kidney cancer, or we operate on patients who have kidney stones, either through traditional surgical approaches or more commonly through small instruments in the urinary channel. So anything related to kidney stone disease and management. When it comes into more of a men's health specialist, things like low testosterone, so the function of the hormonal function of a man, urinary incontinence, maybe after surgery, or prostate enlargement issues that may be associated with it. Of course, erectile dysfunction is the other big one. The inability to be able to get a good enough erection. And then the rest of our field is things that are pertaining either to men's issues like testicular cancer or to women's issues as well. There are some urologists that spend time on the other gender, but the men's health specialist really hones in on those kind of common issues that we all deal with as we age as men.
If I'm having an issue, how do I know if I need to see a urologist or a primary care doctor?
It's a good question. I think, I'll tell you, I've had enough patients can ask me if I'd be their primary. And I really wish I could. I don't treat, however, cholesterol issues or high blood pressure. Those really are done by the experts in those areas. For us as urologists, I'm going to focus in on that smaller, more narrow range of things. And then what you'll see is that we oftentimes have some overlap. For example, we can't see every person with prostate enlargement symptoms because that would be a lot of us, tens of millions, right? Men will get this as we age. So our primary care counterpart, since there's more of them, will then be able to come and say, okay, well, here's, I'll address these issues up front and refer to you if we're running into a roadblock in terms of the success of treatment. So that's where we'll overlap with our primary. Oftentimes I'll tell patients, listen, you can come to me for screening, but if you really, want to start, your primary care is okay to work with until you both feel like maybe we need to take it to the next step.
Okay. So what are the most common reasons a man will visit a urologist?
Honestly, when it comes to my area, the biggest thing I'm seeing in my office is ED, erectile dysfunction. We also deal with a condition called Peyronie's disease, which is kind of a curvature of the penis that can happen as a result of a number of different reasons, mostly some sort of trauma. Those are probably the two things that I see on a day in and day out basis very frequently. And then, of course, the second thing right behind it is prostate enlargement issues. Weak stream, straining, dribbling, those things that irritate us. Those are going to be the two things we'll see very, very frequently, particularly as a men's health specialist. And then finally, kidney stones, particularly my part of the country, very common. So that's fills my schedule as well.
Is there any sort of stigma that you would like to break today about being manly and not needing to visit the doctor? What would you say to that?
Yeah, it's interesting. I can't tell you how many spouses, how many wives I'll speak to and say, I realize what a challenge it is to take care of men. Women early on in their lives are going to the doctor and kind of get used to the idea of being evaluated. For example, my wife will tell you, she said after the birth of my son, she goes, there were so many people in the delivery room looking at my private area. She's like, at some point, you just lose all cares and concerns. It just is what it is. I think women have, believe it or not, the benefit of that because as they age, they're more in tune with their bodies. They're more likely to go seek out care, to listen to the doctors and work with them on solutions. As men, we sort of, after our last high school physical for our sports team, we don't have anybody lay hands on us for the next 30, 40 years. And all of a sudden, it's, hey, doc, what are you doing back there? Having to get a prostate exam or whatever else that's there. And I think that's a stigma that comes with particularly with men's health is I'm fine. I don't need that. Don't worry about it. It'll be okay. And that attitude's unfortunately fairly pervasive. And I really think if you dig deeper, it's because it's more anxiety, right? It's not because you think everything's okay. It's because, gee, I really don't want that guy doing that to me, or that doesn't seem quite right, or all the rest. And I think getting over that and saying, you know what, this is my body. I got to take care of it. It is, more valuable to me than the car that I'm working on in my garage, right? I mean, we pay more attention sometimes to our vehicles and changing the oil and servicing it than we do our own bodies. So being able to make sure that you get over that to get whatever we need done, super, super key.
Very well said. So talk to me about some factors that may be causing or contributing to symptoms such as age, genetics, trauma, underlying medical conditions. What do you want to tell us about that type of thing and how it kind of plays into our overall conversation today on when to see a urologist?
Age is interesting. So I'm going to start off with there because the three things that we're going to see as we age. One is testosterone problems. Two is urinary issues. And three is erectile dysfunction. And when you look, those things, when they happen, to how severe they happen, right, is variable in patients and really predicts the impact on their life. For example, I was 43 years old when I was diagnosed with low testosterone. It's an impact in my life. My numbers, believe it or not, were at the same level of what a patient of mine that was 70. That had a big impact on how I felt and how I was able to perform in, whether it was, believe it or not, mental cloudiness or fatigue or difficulties recovering, whatever the circumstance, that was a big deal. And as we get older, obviously those issues become more and more prominent. So age plays a role in predicting that. And, the younger you are and you start getting these troubles, the worse it may be for you in the future. Same thing again with urinary issues. Prostate enlargement is bound to happen to basically all of us. The degree to which it happens and how bad the symptoms get, well, that varies. And the need for intervention, the need for treatments also varies for patients. But it's something we can sort of count on. And then the last thing really in terms of ED, or erectile dysfunction, I'll tell you, that is another one where you start seeing the effects of kind of chronic medical issues then taking a toll on our function as we age. Kind of realizing how aging plays a role. Now, genetics, the big thing in genetics is related to, in my opinion, prostate issues more than anything else, but also I think to a certain degree, even testosterone. I know my dad had low testosterone, so I'm welcome to that world. Prostate and urinary issues, absolutely, are tied in with each other. Risk for prostate cancer and family history, very important as well. ED is a little bit different in the sense that there's so many different causes, of course, and, if it's related to heart disease, maybe that's your genetic relationship. But that has more to do with age and just the effects of medical issues. The trauma thing is interesting. I think going into the Peyronie's discussion for a second, Peyronie's disease is curvature of the penis that can happen. And the kind of concept behind that is that there's scarring because of maybe what's thought of repetitive microtrauma. That's the terminology. Basically, over time against the erect penis, when it's bent in awkward directions, it may create a scabbing or a scar tissue within the substance of the penis that leads to curvature. So trauma in those folks, is definitely a major source of that issue that plays a role in the development of the disease. From a general health perspective, being overweight, not eating well, not exercising, can really put you at risk for all of those issues I just mentioned. Obviously, the Peyronie's disease being the exception, but we see, for example, that obesity is linked with a higher risk for urinary troubles. Certainly, men who are obese have a potential for low testosterone. In my journey and in what we've talked about in other episodes, I lost 50 pounds and dieted and exercised, did all the right things. And that, certainly has helped my levels. Erectile dysfunction, no question about it, that issues like heart disease caused by, let's say, smoking, high blood pressure, the effects of medications that we use to treat those issues, diabetes, the unhealthy lifestyle that is associated with some diabetics. You realize that those things then have a downstream effect on what I think is a pretty important thing, which is our penis and our prostate. I think those are important things to take care of. Those issues or those medical conditions definitely play a role on the health of our organs.
Definitely. And I want to ask you a little bit more about your own personal journey with your own health. Was it a lifestyle factor thing? What really turned the corner for you in terms of getting help with your own personal health and that journey? Tell us a little bit about that.
Yeah, in my job at Carolina Urology Partners, my practice, I'm the president of the group, and I remember working with my administrative folks right around when COVID started, and the stresses that came from there. Right, we didn't know what the world was going to look like. We had no idea what would happen to medicine, to our jobs, our livelihoods, because for the first time in many years, physicians were impacted by this, right? Doctors usually we're here to help no matter what, and we don't really get impacted too much about what happens in the outside world. Well, that all hit us, and we were doing some very, very difficult decision making about how to preserve our practice and take care of our employees and our patients, all the rest. I remember coming home that night and looking at my wife and saying, for so long, I wish I could control the world. And you can't, right? You can't control the world. You can control the things inside of you. You can work with yourself and fix the things you can fix within yourself. And that was the wake-up call. I was 55 pounds heavier than I am now. I was not exercising. I had my testosterone issues we just discussed. I was really abusing myself. And I was realizing that I was kind of taking a one-way trip to some bad places. And if it's just as simple as, GED and low T, okay, well, that's still pretty darn crummy. But what about heart disease? What about stroke, heart attacks? And, as a young guy, I'm only 45. That was a real life risk if I continued that way. So that kind of wake-up call was, gosh, this is real. I got to really focus on the things that I can help within myself. And with hard work, dedication, time, right? I did all the things I needed to do, and I've really noticed the benefit. My cholesterol is in normal range. I still have a little bit of a belly, and I still enjoy a slice of pizza or 2 or 3 every now and again. But I've really made those changes, and I feel better. I feel stronger. I feel younger. I feel more healthy, more mobile since doing all those things, that exercise, the diet, kind of fine tuning myself. So it's been a real good thing for me. And it's something that I'm so happy to bring to my patients now, because I can also hopefully serve as their role model. I can be their advocate, but I can also be their role model, which is really cool.
Absolutely. Ladies and gentlemen, you've been listening to Dr. Richard Natale. He's with Carolina Urology Partners, and he's a men's health specialist and urologist in the Charlotte, North Carolina region. We've been discussing men's health basics and when to see a urologist. Dr. Natale, is there anything else you want to tell us about why it's so important to raise awareness on this issue, why we're having this discussion today? Anything else before I wrap it up here for us?
I think it's so important for us to realize that, men need to be their own champions. I think there's real great studies that show that the most men, their spouses are the ones that kind of push their health into the forefront. It's really us that we kind of pull back in the shadows. And if we have these problems and, we don't really go get help. I always give my example to patients of the kind of the grumpy old guy that would come home from work and pass out on the couch because he was so tired. And I would tell him, that's not normal, right? That may have been low testosterone. And these guys came home and they didn't pay attention to their health. And guess what happened? Those are always the stories you hear, that then they were tired and they dropped dead from a heart attack. That stuff, I think, was not well paid attention to until more recently. That is, our health needs to take priority, and we need to have that in front of us. We don't need to be in the shadows. We need to call attention to the problems we have. And yes, it may involve awkward exams and uncomfortable exams or medications and procedures, but in the end of the day, if we can make things better, it's going to be good for us and going to be good for all the people around us that love us and rely on us. So as a men's health advocate, as a passionate kind of champion, I really try to bring my patients out and say, okay, come on, man, we can do this. We can get to all these problems addressed and move past them. So I do think that's an important thing. It's a key for all of us to really hold on to. And I'll be here as long as I'm permitted to be your champion.
Great stuff. And of course, anyone listening to this podcast today can visit charlottemenshealth.com to learn more about Dr. Natale and all the fine work he does in men's health. Thank you again, Dr. Natale.